Okay, so I mean we'll discuss about transportation, but there are some things that you need to transport them in, like high slurry. Yes, one is blood gases, two is what?
Vitamin B.
Lactic acid. Lactic acid. These two, you have to send them in high slurry. But vitamins and so on, you have to protect them from light.
When we at the hospital, usually they perform the IV, to connect to maybe medication or food.
Yeah.
So is this different way to do it, or is this different process?
No, that one is different. This one is a laboratory test. That one is they want to give you an infusion or a medication and so on. But the technique is basically the same, but you have to know where you need to go in.
Okay.
In that case, you will go into the veins. In this case, you get into the arteries.
Only from here, that's what? Only from
Yes, only here. That is the major site. Okay? You go into the arteries, but that one, you go into the veins.
Yeah, because sometimes when they fail here, they looking for different places. So it's
that is for that, but this one you can't go. Yeah. You might, there are alternative sites, but that's the major site.
Pressure has been applied to the puncture site for 5 minutes. Affix the gauze with some tape. Dispose of all sharps in the designated sharps containers. The most common technical difficulty associated with radial arterial puncture for arterial blood gas analysis is failure to obtain a blood sample because of vasospasm, or obtaining venous instead of arterial blood.
What is vasospasm? Vasospasm is when the arteries are spastic or they like highly contracted, and it's difficult to get blood. They are very contracted.
Vasospasm is suspected, abort the procedure and reattempt it on the other wrist. A blood sample is likely to be venous if it is non-pulsatile and dark in color and it flows slowly. It should be noted, however, that very deoxygenated blood in a patient with hypoxemia could also appear dark, even though it is arterial. Serious vascular complications of radial arterial puncture are rare and include radial arterial aneurysm, hand ischemia, and hematoma causing compartment syndrome.
What is an aneurysm?
When something bursts, right?
Yeah, when the arteries are ballooning, it's called ballooning. Like a balloon, they balloon. That's called aneurysm. So that's one of the complications, radial arterial aneurysm. Hand ischemia means what? When the hands are becoming what? Dead. That means they don't get, because maybe you damage the artery here, so it doesn't get blood supply. That's one out of the wrist. So especially if you don't do Allen's test, and if Allen's test is negative, then you see it means already the ulnar artery is also maybe damaged before, so it doesn't have any other thing to supply, because if you damage this artery, so it leads to hand ischemia. That's one complication.
The hand ischemia is the
Arterial blood gas analysis provides useful information.
Is dead?
Yeah, hand ischemia, I mean, when the hands are like dead, the tissues are dying.
Regarding respiratory and metabolic pathology. The partial pressure of carbon dioxide, bicarbonate concentrations, and pH values will assist in diagnosing the presence of primary or mixed respiratory and metabolic acidoses or alkaloses. The partial pressure of oxygen will reveal abnormalities in blood oxygen content and the presence of hypoxemia. With the appropriate technique, radial arterial puncture for arterial blood gas analysis is a skill easily mastered by medical trainees. A more detailed approach to acid-base disorders and hypoxemic respiratory failure, while necessary, is beyond the scope of this instructional video.
Okay. I think we'll finish this one here. If you go here, read the arterial puncture topic on page 27, so that will give you all the summary for this.
In this one?
Yeah.
So Dr. right now the phlebotomists, they also can do the arterial, yes?
Eh?
They can also do the arterial puncture?
Oh, no.
The phlebotomist?
No. At this training level, no. Just you have to know it theoretically. Okay, but someone who's trained for this, you have to get training for specific.
But you are just is a information. It's not because of a scope of it.
Yeah.
This.
27 years. Okay, I want to summarize. I think this is mostly that you do it here in this class, but I want to go over page 32, which is order of draw. You know order of draw is our friend, yes?
Yep.
What page?
Page 32.
32?
Yes. So order of draw. Why do we put tubes in order of draw?
Because each tube contains different
Yes, different additives.
inside.
So that you try to prevent the contamination of one additive with the other tube or tube additive. So to decrease that contamination, we need to use order of draw. Okay?
32.
Yeah, that's what I he said I would add
This one here? No.
it's kind of like I guess like some kind of like liquid. Yeah, so that's why we do it in order. 'Cause
Okay.
for example, if you do the red top first and then the yellow top, by the time we get to the red top, it's no longer gonna work. So that's what we have to do.
Okay, so you know we have our, I think you know my table here. I think that table should help you a lot. I mean many things, especially this one, the color stopper. You have this one, yes? Yes. So these are our like tubes. Yellow tube. We have light blue. We have serum tubes, which are what, gold, red top. And also we have the tiger top, or which is called the speckled top. Okay, and then orange tube, green top, pink top. Okay, pink and lavender. This is lavender, I think it's not visible here. Lavender and pink. Okay, or purple. And then gray and the last yellow.
Wait, so why is on that thing you have yellow first and yellow last? How do we know which yellow goes first and which yellow goes last?
Yeah, this one is, these two yellows, they have two different additives, okay? So you see which additive it is.
So if the both tubes are yellow, how are we supposed to know which one goes first?
The additive is on the tube. You have to see the additive.
Oh.
Because on each tube, the additive, the name of the additive
It tells
is
you
labeled,
on
okay, it's
the-
written. So because it's written on there, you have to see the which additive it is. So each tube has the additive. There is no tube without additive, because they have to label anything that's inside. It should be labeled.
So can we have this page, copy of this page?
Yeah, I think you have it, okay, in your book.
We have
It's this.
Yeah, I gave
Except
you.
his looks like that.
page is right.
32. Oh, is it kind of?
the same yellow. This one.
Yeah, so since there's two yellows, you have to look at the two to see which yellow goes first and which yellow goes last.
I mean, it has some,
It has different like
yeah.
additive inside.
What is your phone number, Gupta?
571 477 9110.
Okay. So, always when you have the first tube is what? The yellow tube. So this is put in order, okay? So always yellow first, also that picture. Yellow first, then light blue, then serum, green, lavender pink, gray, yellow. And we'll put also in between some like the specialty tubes like royal blue, tan top, orange top, and white top, okay? Now the yellow tube, what is the additive is what? SPS, which means sodium polyanethyl sulfonate. Usually you don't need to know all the whole name, but this is good to know it. For which test is that being used? For blood culture. Okay? How many times do you invert it? 8 to 10 times. Invert 8 to 10 times. Okay? If you don't use these tubes, then there are bottles, what we call blood culture bottles. You can use 2 bottles, like 2 different kinds of bottles. One for aerobic, one for anaerobic organisms. It's mentioned here. It's aerobic bacteria, and for anaerobic bacteria, you can use 2 bottles. Like, let me show you these bottles. Like this. Okay, 2 bottles, one aerobic, one anaerobic.
What's the difference?
So because we classify bacteria into 2, aerobic, anaerobic. Okay, aerobic means those that utilize or that like what? Oxygen. Okay, and anaerobic means those that do not like what? Oxygen, or they hate oxygen. Okay, so those organisms that are aerobic will grow in the aerobic bottle, and those anaerobic will grow in the anaerobic bottle. So that you can identify these 2. So that is if you don't use the tubes. That's an alternative method. So the second tube is light blue. So you know our light blue here, yes? Light blue. So what is the additive inside light blue? That is sodium citrate, or sometimes it's also called citrate tube. Citrate. Why is it called citrate tube? Because the additive is sodium citrate. Okay? And then for which test is that being used? For coagulation. That means when you want to check the status of the blood clottings in the blood, then you use this tube. Okay? There are some clotting factors in the body. Okay? And which are these tests? Like PT, or which is called prothrombin time, PTT, partial thromboplastin time, APTT, activated partial thromboplastin time, and D-dimer, or some other factors like the blood clotting factors like factor 5, factor 8, factor 9, factor 10, factor. There are also other 11, 12. There are around 13 factors that are the most important factors that are very essential for blood clotting. So that means by testing this, you know the status of the coagulation factors in the. So that's very important, because let's say if the clotting, if the PT is longer, what does it mean? It means the blood will not stop fast, yes? So in that patient, are you going to do the surgery? Let's say surgery is being done. Yes, you don't do this one, you don't know the status, you open that, hey, it bleed. How can you stop it? Yeah, it's very difficult. So you have to, this is very essential in all, especially pre-surgical, and in those patients who follow for bleeding disorder.